Uh, Guys, welcome to Pro Wellness Initiative. We're doing another Spotlight Authority video today, and I'm really excited actually for you to meet Jessie. I have known her for quite some while, and she just taught me something new when we were gabbing before we hit record. So we're going to talk about all the things today. But first, obviously, I want you to introduce yourself. And the first question I always like everyone to answer is, how did you decide to get into functional medicine?
Hi, I'm Jessica Olavarria, nurse practitioner. I go by Jessie, is fine. And the way that I came into functional medicine was I was a nurse and then became a nurse practitioner in the emergency department. And I just looked around and was like, I'm not really helping these people. I feel like I'm just putting band-aids on the same owies essentially over and over and over again. And I would say, did your primary care tell you about this, or didn't and they would say no. So it just was, there was a real lack in education. And I grew up in the South, and so we would be walking down the road and I would say I got stung by a bee and my mom put tobacco on it, and that's how we solved bee stings back in the days. We put tobacco on. So we were always using the earth to heal ourselves when I was kids. I didn't know that was going to end up being my ultimate destination, but I definitely learned just a lot from hanging out with them as kids. So that's how I got into it.
Yeah, I love that. I grew up in Alabama.
Georgia.
So, same, and just always, stuck with that. So let's kind of dive into a lot of questions that I know people are going to be watching this. I'm going to use myself as an example because that's probably the most relatable to a lot of the women watching. I've had different things at various points in my life going on, and I go to my PCP and my primary care physician, and I say, hey, these things are going on, doc. And, they do the basics, and I call it sick care, not health care, because they do the things to make sure, well, you're not sick and you're not dying, so you're good to go, right? Explain the difference in what you do if someone comes to you with the same thing saying, hey, I don't feel right. I don't feel the same. Something feels off. And I went to my doctor and they said I'm fine.
Right. Right. Yeah, that happens a lot. That's mainly the patients that I see. In primary care, you're allowed like 15 minutes to see a patient, maybe 30 if it's their first visit, and that's just not enough once a year, right? And that's just not enough time to really dig into a patient and see what's going on. I was in primary care for a while. I know how they think, and I know how they are, the quotas and metrics that they have to meet. So I'm not blaming them at all. I'm saying that we need to do that differently in primary care. But until that time, there's functional medicine. And so I'm licensed in functional medicine as well as primary care. A lot of my background was in the emergency department. So I get sick and I get not sick. And so being able to put those together and treat a patient, we get down to the root cause of an issue. We sit down for your first visit with me is an hour long, and I give you a 6-page intake form to fill out 2 days before you see me, at least 2 days, so I can really sit down and look at it and think, okay, these are the questions that I want to ask them. I want to ask them, did they get bit by a leech when they were a kid too, because of what they said in one of their other just little things that you pick up on that a primary care provider wouldn't necessarily have time in the 15 minutes before you see them. So it's getting deep into your history and what's going on. It's a little thing back in the past that maybe you would think would not be important, but could be a catalyst, a linchpin holding this whole thing together. So, or making it fall apart. So I spend that time with them, getting to know them. In functional medicine, we get to the root cause of it. If you have low iron, we need to figure out why you have low iron. Right? You're supposed to be absorbing it. And if you're eating the foods that you're supposed to, we need to know why you're not absorbing it and treat that. So you can go the rest of your life absorbing iron like you should and not have to take pills and not do things like that.
Yeah. Okay. So now let's kind of break that down. And obviously you work with women and men. I think a lot of women come to you, but you work with both women and men. And, in each phase, we go through a lot of different things. I want to really push being proactive here, right? And so you talked about root cause. And, I think you and I are both on the same path where we would love people to start coming to you before it gets bad, like that first cue, right?
Yes. And that's education, right? That's education. Right. That's putting education out and saying, if it's going to cascade into this, come here, come at this point. Or get the education to kind of stop that from happening beforehand, right? For example, if you continue to take this medicine, this is what's going to eventually happen to you later on. Let's just go figure that out here so we don't have to take the medication and do that. But I'll take them at their lowest, right? Because that's the point where they are really ready just to be honest and tell you all their pains and everything that they're doing and how they're probably are waking up in the middle of the night and eating ice cream because they just feel so terrible, and things that they probably wouldn't tell somebody else when they're not at the end of their rope. So I'll take them there, but if we can educate them to not get to that point, that is absolutely 1,000% my goal, is to educate these people so they can say, huh, nope, I'm not supposed to do that because this. That would be my dream.
Right. So what does that look like? Let's go deeper down that path. You know, they reach out to you because there's some cues, their body's kind of whispering some things, or you may be screaming some things, and they come to you. So talk a little bit about the process of what they can expect, because it is very different than, once again, going to your
So you call the office and we can do two things. We can do a 15-minute no charge consult at the beginning where you just say, these are my issues. Do you think that you can help me? And if I can't help you, I will be happy to pass you down the line. I'm not about taking every single patient, because if I'm not going to do right by you, then that's no different than any other provider that you have. I want to make sure that I can help you to the best of my ability, and I can really help what you have going on. So 15-minute no charge consult, we just get on real quick, we talk about issues, and I say, yep, I believe this is something that I can do, or no, I don't, and here's who I think can help you. Because it's not about gatekeeping. It's not about, I only want you for me. It's about doing what's best for the patient. And sometimes it's not me, and that's okay. At some point, it will be me, because I can help with what things that they'll have going on. But at this point, it may not be. Otherwise, you can call the office and make a appointment for an hour consultation, and we set that up. And you give me about a week to look over your paperwork and get all my questions in, and then you come meet with me for an hour, and then we decide from there whether it's we need more labs, whether we need to move forward with a stool test, whether we need to work on a lot of somatic care, right? Just like, oh, we got to calm this body down. We got to listen to it. It goes with lab work as well. We would probably do lab work at that time. It's a little bit deeper than your regular PCP lab work, because sometimes they're just looking at, just these numbers, and they're not looking at everything that's connected to those numbers that could make those numbers change. So we go a little bit deeper with lab work. And then we would probably do a stool test or some sort of swab to figure out what's going on and create a treatment plan for that. There's a lot of, in Florida, of course, there's a lot of like mold issues. People are concerned about mold, and that's definitely something to think about. And I don't think it gets looked at as seriously enough in Florida. So that's a big one a big challenge that we take on. And every patient looks different, though. So if somebody comes in and they say this, and this, we might have to do this before we can get to this, even though this is what they want help with. And I think that frustrates people in functional medicine, is that we gotta go down the path, because going here, if we fix it, it's just going to break again, because your whole path before had some roadblocks.
Right. Okay. So with the labs, when you say labs, for a lot of people that are kind of curious, like, what does that mean? What kind of labs, and how are they different, as far as all of the markers that you're looking at versus probably just a typical lab work, when we're not putting down or telling them, not to go to PCP.
I'll use everything they have. Yeah.
Right. I've learned in my own experience that, a functional medicine doctor, practitioner, you're always you take the deeper dive, and actually you get typically what I've seen, you get this full panel.
Yes. Yeah. There's just a couple of numbers that in your regular traditional lab that you would get yearly, they just look at a couple of numbers and say, yeah, these look good, or these look bad. Before the typical panel that you get from your doctor, before those numbers go bad, there are numbers around it that have already gone bad. So for example, a thyroid panel is a full thyroid panel. It involves the antibodies, it involves TPO, it involves all of those. Those numbers go bad before your thyroid numbers go bad. So it's almost like we've had a hint ahead of time, right?
Right.
When I do labs, I can look at trending labs. I can look at their trending labs from the provider, and I can tell you based on your trending labs where we're going in the future. So it's a little bit of fortune telling by saying, okay, well, your A1C was 5.1, 5.2, 5. Okay, we're trending up. We can see diabetes in the future if we don't stop this now. And also the numbers that you see in primary care that are on those labs that are within normal limits, if you go 0.1% on either side of them, so 0.1 in the decrease or 0, you're already in a disease state process. So that, to me, that's like having going down the interstate 90 miles an hour and having a stop sign right before a brick wall. Like, you're never going to make it, right? You're already sick. So why in functional medicine, we can look at your trending and essentially get you a couple of exits up and say, get off, let's change the oil, maybe kick the tires, maybe change cars even. Like, we need to fix things entirely. And that's, to me, the beauty of functional medicine is you can see it coming and head it off at the pass.
So now the next thought that came to me as far as I really want to take a deep dive is right now the trending thing out there for weight loss and for hormones. I noticed that a lot of people are going and they are able to get a lot of, peptides and different things online. And they're
Mm-hmm.
not, and they don't know if they're taking the right dose. A
Mm-hmm.
lot of them are not getting lab work done. And I really want to help people understand that why they should come and get their lab works done first. Like we were talking earlier about hormones,
Mm-hmm.
do you really need the hormones
Right.
now? And like you were talking about overcorrecting and all those things. So let's talk about the hormones first.
Okay.
You got women, menopause, perimenopause, men have andropause, all of these things going on.
Yes.
So what that process should look like, according to your studies and your practice.
For hormones.
Yeah.
In my practice, and I may do things a little bit different. I've had a lot of patients just come to me and say, I want hormones. And I'm like, there's a long road before we get to hormones because truthfully, the gut, which is the second brain, I would wager to say is the first brain. I think this brain, stops us from accidents and causes us to overthink and run from a bear. Sure. But the gut is really the one that's running all of this show, everything in here. And so if the gut is messed up, you have to think of the gut of like the United States Postal Service. When they're delivering that stuff to the gut to be delivered to the rest of your body, if the gut is sick, it's like the USPS, they lose the mail. They don't deliver the mail. They keep the mail or they throw it out. And so then all of a sudden something will happen. They'll be like, oh no, we have all this estrogen, for example. We got to deliver it to the body, and delivers it to the body. And the hormones are like, wait a minute, what happened? Why are there so many? Okay, well then we need to slow down. We got to stop making so many. And then that's when you have the big lag in between. So that could be estrogen dominance or estrogen. That's how that works, to go up and down that. So if I were you to come in and I was going to test you on just the numbers that you have going on, I have a real potential to overcorrect you. And it is way harder to back down that mountain than it is to climb up incrementally. So we test those. We take a look at your gut and make sure that it's delivering the USPS and it's delivering the mail like it's supposed to. And the truth is that once we look at your gut and get that mail delivered, if you do need hormones, you won't need as many, right? You won't need as much because it's getting what it needs. The UPS is delivering the mail every day like it's supposed to, instead of being overworked, frazzled, and not having what it needs and holding on to it and or throwing it away. So that's how it works at my place. Is we start at the bottom. We start at the base, make sure you have a strong foundation, and then we can build on top of that. But if we have a weak foundation, you're going to fall every time.
Yeah. So let's talk about the next thing then. People that are coming in like, I can't lose weight, or, or help me lose weight as well.
Yeah. Well, a lot of that is, again, it could be hormones. The body's not listening, right? The body's not listening because the all of the signals that are being sent to the gut, that's just holding on to them because it can't process them. It can't function. It's overworked. It's tired. It's hungry. I mean, insert whatever here. The weight loss is usually where your body has been trying to talk to you for a while and you haven't been listening. So we teach you how to talk to your body. We introduce the foods that work specifically for you, right? We're not going to say, don't take this, this, and this, and then try this. It may not work for you. You may have a nightshade allergy. You may have things that don't work for you. We find a meal plan that work exactly for you. And then we also teach you to listen to your body. And we also check your levels. If your levels of vitamin D are in the toilet, you're not going to lose weight because we're missing a crucial building block to it. And then that's why we look at all your other labs. If they're out of whack as well, then your body's like, I don't feel safe right now. So I don't feel safe. I'm not going to drop the weight. The body has to feel safe in order to be healthy.
Yeah. I hope everyone really hears that. I was in fitness and wellness for 17 years before I switched over to what I'm doing. And, I would always try to tell people that, like, if you're forcing your body to basically be in fight or flight, I mean, for lack of better words, it's going to protect itself. And typically, especially for women, it could be putting on a lot more body fat and, storing things because it doesn't know when it's going to get it, which is why the whole
100%. Yes. If you starve yourself, then the next time you feed yourself, the body will go, okay, we don't know when we're going to get it again. This is what happens with GLP-1s. When they eat, the body says, we don't know we're going to get it again. We're going to hang on to it. Same thing with water. You don't drink. A lot of people think, oh, I don't want to get water weight. Okay, well, when you do drink any water, it's going to hang on to it because it doesn't know when it's going to get it again. Everybody
Yes.
thinks, why did things start falling down around 40? You know, I just hit 40s and everything is falling down. That's because you've been compensating for the 40 previous years. Your body has been trying to keep up, and it's a machine. You just can't anymore. So it's going to force you to listen. If you don't listen and the little nudges that it's giving you, it's going to force you to listen. But sometimes it's a sudden hard stop. For people, a lot of times it's weight loss, sometimes it's a heart attack, sometimes it's my knees hurt. But it's telling you. So if you listen to her or him and make them feel safe, they will work for you. They want to work for you.
So all the more reason to, even before they go to the trainer, they go to the nutritionist and all that, like really coming to someone like you and understanding what their body is doing,
what it's saying. Yeah, because the nutritionist and the trainer, they're doing what their job.
Sure.
Sometimes it's just generic. Sometimes the nutritionist is like, yep, this, just have this diet, but it's not necessarily for you. That trainer is like, yep, do this workout. It's not necessarily for you. And so that's where being in touch with trainers that are in the functional medicine world as well, right? Nutritionists that are in the functional medicine world, because it's not a one size fit all. It's not. So you need to know, these are my numbers, these are my limits, this is what I need to work on, and this is where I need to focus. And once they know, they can do their job tremendously. But if you're just going to them, they're going to say, sure, lift this heavy thing 12 times. Bye.
Let's also talk a little bit about, I think hormones affect it, but autoimmune is also very big. I don't want to call it a buzzword because it's been around, but I think more people are understanding that they could potentially have autoimmune. And once again, I do think unfortunately some of them go to the doctor and the doctor maybe doesn't have time to really fully understand or listen to what's going on. So coming to you, is that something that you see a lot, is autoimmune?
I see a ton of autoimmune, and I want to say that I know that these providers are doing the best that they can.
Right, right.
And I'm not knocking on them. I was them at one point. I get it. They're doing the best they can. And I just saw a different way. So I saw a way that I could actually sit down and help patients the way that I'm lucky enough to be able to follow this path. So hopefully they'll come join me. That's the goal. Come join me. Let's come over on this side. It's better. But yes, I'm seeing a ton of autoimmune, and it makes so much sense when we think about what's happening in the world right now with what's going on in our food. They're slowly, systematically, make no mistake, they're taking away our food choices and introducing more processed foods and foods that are made at these huge farms and that are injected, these genetically modified foods. That they're taking all the seeds out. Why are they taking the seeds out? Why is there seedless watermelon and seedless grapes and seedless? Because eventually seeds won't be available to us, and then they'll really control the food, right? And once you control the food, you control the people, because we got to eat. So that's why knowing your food, knowing what works for you, learning to grow your own food, learning to take care of yourself, learning to know your body. Genetically modified is never going to be good enough, better, or good as good as coming out of the ground, period. And if something's genetically modified, your body's going to recognize it as an invader every time. It's not going to say, oh, that's a banana with a little spice to it. It's just going to be like, that's not even a real banana. So the body starts attacking. And when the body starts attacking things that are not self and not real, it can think of your immune system like the Avengers. This is how I explain it when I'm explaining my stool sample. I'm like, look at your Avengers right here. They're tired. Everybody's tired. They've worked themselves to death, and they've worked themselves so hard that they're so tired, the body has started fighting itself. And that's what autoimmune is. It's been fighting against something for so long that they can't find, and or we're not changing, right? Like we're not changing. We're continue to introduce the insult that eventually it fights self and turns on self. And that's autoimmune. That's what that is. So there's a reason that it's fighting self. We got to find out what that reason is. I may not be able to help you get all the way to the pinpoint. If not, I'll take you as far as I can and then move you on down the line to the next person that can help you. But getting on, not introducing things that are going to make your body mad, right? That's number one. You got to figure out the things that are making it mad and stop doing it. I mean, you would stop being overtly mad if somebody would stop punching you in the face 3 times a day at every meal, right?
Right.
Every time you knew food was coming, you braced because you knew you were going to get hit. So we stop punching ourselves in the face, right? We figure out what's causing it and then stop giving in that. And then over time, we try to repair the damage. And it's not just even on the inside, right? We got the supplements, we got the medications, we have the lifestyle changes, but it's also a lot of talking, right? It's a lot of talking points. You think Your body doesn't listen to you, but it listens to every thought that you have. So it's a lot of tell me what's wrong, show me what's wrong. You're safe. I'm listening. Things like that I think are remiss in probably a lot of offices, because people don't think that your body is listening. But if if your kids listen to you and your dogs listen to you and your friends listen to every word you say, why wouldn't you listen to you?
Yeah, that's a really valid point. When we focus on wellness and we talk about, physical health and mental health and emotional and social and all of these things, we never quite make that connection that also means, what
So,
we're choosing to say and think and take in, for ourselves internally, those little silent things. I practice that actually every morning when I wake up. I say, you know, show me everything good that can happen today, or good things
you
are going to
believe
happen
it.
to me tomorrow, or,
Yeah. Yeah.
and a lot of people think it's woo woo, but it works. I mean, because your body and your brain's listening to what you're
Yeah.
saying.
So what if it's woo woo? Be a little woo woo. Like
Yeah.
they say there's no woo woo in medicine. That's not true. Like there's something to be said about saying to yourself every morning, I think you're doing the best you absolutely can. And I like you. There's
Yeah.
something to that, right? If you wouldn't say it to your daughter or your mother, don't say it to yourself.
Yeah. Yeah. I love that. So one of the other things that I wrote down too that I just want to talk about is just overall, we talked about being proactive,
Mm-hmm.
right? What is the benefit of just going? No, I don't even go to the doctor. I go to the doctor once a year to get my blood work done, and that's it.
Yeah.
Like, however, what would be the advantage of them still coming to someone like you and taking that deep dive and being proactive now?
Okay, twofold. First fold is kind of what I said before. Your body, you could feel fine. You could feel what you think is fine, right?
Right.
But your body could be silently screaming, and there's compensation going on. And then eventually, you're going to wake up one day and hit the wall and be like, "Where did all this come from?" Okay, there could be compensation going on. But if that's not the case, if you do have everything going well, and that's great that you do, knowing yourself, knowing your body, knowing how it feels, you can even perform like little experiments on yourself, right? If say we do a stool test, I'm like, this really doesn't work for you. You should probably cut this out. And then you go, but I feel fine with it. But let me see how I feel when I cut it out. And you cut it out, and I was like, oh, well, I mean, I'm waking up a little bit earlier, a little whatever. I think food's tasting better. Actually, I'm not as bloated, things like that. Knowing your body so well that when there is a change, you know it the moment it happens. And not only do you know it, you can articulate it clearly to anyone listening. And that means the primary care providers that you go to. I used to do this, and now this is happening. That is a very good direction to give someone in a primary care office, right? This used to work, now it's not working. Okay, well,
Hmm.
we can work with this. That's how you just can't walk into a primary care and be like, I feel terrible. Welcome to the club. Everybody feels terrible. What do you mean?
Yeah.
But if you know your body well enough that one thing goes wrong, you can say this was working, now it's not working. That's a really good area for your primary care provider to dive deeper and go. So
Okay.
knowing your body that well that when there's one thing wrong with it, you can say, I know this is wrong. I need to go.
Yeah. Someone does come in and, you've done the test, you've done the labs, and then, kind of what's next and like, what does that look like? So I know you have some programs,
Mm-hmm.
talk a little bit about those and like what that looks like, because I think that's what everybody also wants to know is like, okay, now we've found out these markers and these things going on, how are you going to help me navigate this? Because once again, a lot of people want their 30 days and you're going to lose weight, or 90 days in this, and you need that long-term
Yeah.
guidance and care.
Yeah. So I always tell my patients, you didn't get sick overnight. You're not going to get well overnight, right? I say I'm sticking with the 40s numbers. Let's just say this was 40 years or 20 years of doing it wrong, or 20 years of hurting yourself and the body's compensating. The good thing about the body, and the thing that I love about it so much, is that once you stop punching it in the face, essentially, it's like it responds pretty quickly to that,
Mhm.
right? It turns out that it's really interested in not being punched in the face. It responds really quickly. So once the body knows that you're listening, it perks up and it starts showing you things immediately.
So last question, um, as you were talking is, and I think some people might want to know, do you do blood lab work as well? And then I know you have the stool lab work that you get done. And why are you doing those? Like, what is the difference? What are they showing you?
So the blood labs are going to show me what's going on in your body, but it's not going to tell me what's going on exactly inside your gut, right? So your numbers will show you your white blood cell may be elevated if you have an infection, but that's a current infection, like right away that happened. It's not necessarily going to show me that there could be something some infections are bad guys essentially happening in your gut. It's not going to tell me what's in there. It's not going to tell me which supplements I need to use to kill them, essentially, to get your gut microbiome back. We do all of them. We do urine, we do blood, we do stool, we do sputum. A lot of times, the Legionnaires is a big thing around here because we do hair tests, hair mineral tests. I do a ton of those to see where you're at minerally, because a lot of times, with copper, nobody has copper anymore. We can't get copper anymore. Don't supplement on your own. It can be dangerous. We got to know your levels first. But copper is a huge mineral that people are missing these days. So we test all of those things we're just not willy-nilly throwing anything at it. We're saying heavy metal wise, where are you heavy metal wise, right? Where are you mold wise? Where are you with those minerals, copper and boron and selenium, where are you on those? We test all of those to know where your body is at. You just can't willy-nilly throw supplements at. You have to know exactly where you stand, and they need to be monitored with that. So we do all of those testing because I need to know exactly where you are with exactly what you have. So the treatment plan that I give you is just for you. You can't take your treatment plan and give it to your mama. You may hurt her, right?
Right.
That's what's the problem. This is the problem with traditional medicine. Same treatment plan for every patient. It can hurt them.
Yeah. Okay. So just to finish off, what is something, a message that you would want someone watching this to hear from you on, once again, they're not feeling like themselves. What do you want to leave everyone with, that message about all of those things, all the things that could be going on, and how, they can find answers?
Yes. I want you to know that you're not broken. Number one, you're not broken. You're not so messed up that you can't be fixed. You're not floating out on a sea by yourself. I see you and I hear you. And I can guarantee that if you have the same issue, then there are others like you that have the same issue. Sometimes just knowing you're not alone is enough too, right? Knowing you're not alone. There are millions of people who feel just like you. And I can see you and I can hear you and I can help you. So don't stop wondering. Stop saying, is this for me? Stop saying, am I the only one? What if I'm so crazy she can't understand me? That's not going to happen, right? And if it does, then I'll send you to the person that can understand you. Mm-hmm. You are not being listened to, and I want you to know that I hear you and I see you.
Okay. And as far as them coming to see you, do you offer only in office visits, telehealth? How does that work?
Nope, I do I can do telehealth. I don't mind doing telehealth. I find that in person is really the energy. It's energy is real, right? So being in person with someone can really get them excited and really get them feeling good about their health and their way to go. So I do both in person and virtually. If you can only do virtually, I'm okay with that. I'm licensed in the state of Florida and Georgia, so I can see patients in both states.
And if they want to come see you, tell them where you are, website, how to connect with you, all of those things as well.
Your 15-minute no charge consult through the website. That's the only place you can do the 15-minute. If you want to do the hour consult, then call and make an appointment with me, because I want to make sure that I give you all the information beforehand. And my email address, if you want to send me some labs or send me an email, we are at teams@GaiaFunctionalMedicine.com.
Awesome. Anything else you want to mention or leave everybody with?
I just want everybody to know that functional medicine can feel scary. And a lot of people can say functional medicine is not real, but decide for yourself. Decide if you feel better. Decide if you like being listened to. Decide if a treatment plan has started and it's hitting all your spots, then you decide for you. Don't listen to some naysayers. Just come, let's have a conversation. And if we don't work, we don't work. But functional medicine is for everybody. And I guarantee that we can help in some way at least.
Yeah, agreed. Awesome. Well, thank you, Jessie.
It was so fun.
All right, guys, go watch the full episodes on our YouTube channel. And we look forward to actually potentially having you as well on some of our panel conversations, where we have a lot of other wellness professionals and we just take a deep dive into very specific topics. So I'm looking forward to that as well. Until then, we'll see you guys next time.
Bye.